Hi everybody. Today's vlog is going to be more of an informational thing. I've had a lot of people ask me about my condition, so here's some information on it. What is CRPS? CRPS is a rare chronic pain condition that normally affects a hand, an arm, a leg, or a foot. CRPS normally presents itself after an injury, a surgery, a stroke, or a heart attack. Now, an injury can be as small as spraining an ankle or as large as a compound fracture. I got my CRPS from a surgery. The number one symptom of CRPS is pain that is much more severe than the original injury or surgery. It is possible for CRPS to go into remission if it is treated early enough. Symptoms of CRPS include a constant burning or throbbing sensation in an arm, foot, leg, or hand. Sensitivity to cold or touch, swelling of the painful area,
systemic fashion in 2016 in our elections. They will do it again. What I would say is I don't think that the president's order is going to have a chilling effect on the Congress. That I'm sure is next year. But I mean, again, I would say that this is a dangerous time for our country. I worry a great deal when you watch the video clip yesterday of the president talking about
changes in skin temperature going from hot to cold or cold to hot, changes in skin color where you can get rashes or what's called mottling, and the mottling can be red or blue. Changes in skin texture where your skin starts to thin out. There can also be changes in hair and nail growth. It can either stop growing or grow faster. You can have joint stiffness, swelling, and damage. You can have muscle spasms, tremors, weakness, or even loss of muscle tissue. And you can also have a decreased ability to move the affected limb. CRPS symptoms can change over time. For instance, when I was first diagnosed with CRPS, my arms would swell and I wouldn't be able to move my fingers at all. And that happened for a consistent period of time, along with skin changes and nail changes. My cuticles have never been the same. Now, my arms don't swell as much, but my skin has thinned out and my muscles are much weaker than they were. CRPS is known to spread from the original injury site throughout the body. Normally, It will go from, say I've got CRPS, my CRPS started in my right arm. It could either go from my right arm to my left arm, or from my right arm to my left leg, or from my right arm to my right leg. With my specific CRPS, mine went from my right arm to my left arm because of a sympathetic block. The causes of CRPS are not well understood, and there are not many doctors who specialize in CRPS, so it can be hard to find treatment. CRPS is thought to be caused by an abnormality in the peripheral and central nervous systems. If CRPS is not treated within the first 6 months and complications do arise, some of these complications can be tissue wasting or atrophy, where you're not being able to use the muscle that's involved in the CRPS because of the pain. So that muscle becomes weaker, and over time you can actually lose that muscle tissue. You could also experience muscle tightening, where your muscles constrict. And for instance, say with my hand, when my muscles constrict, it closes my fingers, and it can actually freeze in this type of position, and you would not be able to get it straightened out again. Diagnosis for CRPS involves ruling out every other condition that it could be, as well as the Budapest criteria. On the Budapest criteria, I'm going to have to read some of it. Continuing pain, which is disproportionate to the inciting event. You must report at least one symptom in all 4 of the following categories. Sensory category. Reports of hyperesthesia and or allodynia. That is the sensitivity to touch and feel. Vasomotor. Reports of temperature variation and or skin color changes and or skin color asymmetry. Pseudomotor, edema. Reports of edema and or sweating changes and or sweating asymmetry. Motor trophic. Reports of decreased range of motion and or motor dysfunction, weakness, tremor, dystonia, and or trophic changes, hair, nails, skin. The next section, the patient must display at least one sign at time of evaluation in 2 or more of the following categories. Sensory. Evidence of hyperplasia to a pinprick and or allodynia, to light touch and or temperature sensation and or deep sonomic pressure and or joint movement. Vasomotor. Evidence of temperature asymmetry must be greater than 1 degree Celsius and or skin color changes and or asymmetry. Pseudomotor edema. Evidence of edema and or sweating changes and or sweating asymmetry. Motor trophic. Evidence of decreased motion and or motor dysfunction, weak, tremors, dystonia, and or trophic changes, hair, nail, skin. And there's no other diagnosis that can explain the symptoms that you're having. Now, there are also diagnostic tests that some doctors use. These diagnostic tests include a bone scan. It's normally called a 3-phase bone scan. Sympathetic nervous system tests, x-rays, an MRI. Now, as I said before, with treatments, as long as the diagnosis comes within 6 months of the inciting event, whatever injury caused it, there is more of a chance of these therapies and treatments working to at least have the CRPS go into remission. But there is always a chance, even if it does go into remission, there is always a chance that it can come back. Medications that doctors use to treat CRPS include pain relievers, anything from Tylenol to heavy opioids. Sometimes doctors use anticonvulsants and antidepressants to treat nerve pain from nerve damage. Corticosteroids are also used to treat CRPS. A doctor might also prescribe bone loss medications like Furosemide to prevent or stall bone loss. Sympathetic nerve blocking medication, where they inject an anesthesia into a nerve bundle that affects your limb to dull the senses in that nerve bundle to lessen your pain. Some doctors will also recommend and treat with ketamine infusions. Intravenous ketamine or ketamine infusions are used as a heavy anesthetic that can alleviate pain, but they do not return function that has already been lost. And in order to gain significant pain reduction, infusions have to be done over anywhere from 3 to 14 days. And most of them are done in hospitals or in infusion centers. Some therapies that doctors recommend and order on a regular basis include heat therapy, where you would use a heating pad or a hot water bottle on the affected limb to help alleviate the pain. Some doctors will recommend topical analgesics like lidocaine to be able to alleviate the hypersensitivity in an affected limb skin. Most doctors will prescribe physical therapy for CRPS patients because there is one rule with CRPS, and that is move it or lose it. So physical therapy is prescribed to help us keep function that we have and possibly gain function that we've lost. Some doctors will also prescribe mirror therapy. I was never prescribed this as a patient. My doctor also recommended a TENS unit, which basically sends electrical pulses to the muscles and the nerve endings. And in most cases, it will ease pain. Doesn't necessarily take it away, but it will ease pain. Another therapy is biofeedback. Now, I've never experienced this one, but in some cases, learning biofeedback techniques may help. In biofeedback, you learn to become more aware of your body so that you can relax your body and relieve pain. Spinal cord stimulation is where your doctor inserts electrodes into your spinal cord, and then you have a remote control that you can send pulses to those electrodes to help reduce or alleviate your pain. Intrathecal drug pumps are a drug therapy used by having a catheter inserted into your spinal cord and having drugs administered through that catheter directly to the nerve site. I hope that this has given you guys a little bit more understanding of what CRPS is. I was trying to make it informative. I'll see you next time. Have a good day.